Incredible.
It's Thursday. It's Thursday. It's 6 o'clock. That can only mean one thing. It's Men's Radio Station. And it's the ABC of CBD with the extraordinary, and he blows me away every single week, Ollie Mammon. This is, amazingly to us, week 29 of this show. And they said it wouldn't last. Anyway, Thank you so much for joining us. I know you listen to us all over the world. We get messages and private messages from all over the world, from listeners and people watching us as well. Thank you so much. You can hear us on www.mensradiostation.com. We're also on Twitter. We're also on Facebook. And if you're think you're going to pop off and make some dinner and then come back, you can catch up everything on the Men's Radio Station YouTube channel, which is Men's Radio Station. And if you're there, do us the hugest of favors. Click the subscribe button. Hit the like button. It does us straight away. Veronica Curran. Evening, guys. Good evening, Veronica. No more, because I've got a very special guest. And this is really where I want to be into. This is my area where I'm really fascinated. So over to Ollie, who's going to introduce his guest for week 29.
Damn, week 29 is awesome. Oh my God, I've had so much fun over the last 29 weeks with you guys. And thank you everyone who's tuned in and everyone who's commented and interacted with us. And, you know, honestly, the show's nothing without the listeners. So thank you so much for all of our listeners. I really appreciate all of you being there because you give this a purpose, which is fantastic, you know. So also thanks to Russ, you know, for taking a chance on a long-haired hippie like myself. I really appreciate it.
What can I do? I come from a family of gamblers, Ollie. What can I tell you?
Basically, you're like red or black, and you've just hit green. Yeah, that's so, I mean,
I don't know what. Well,
so episode 29, we're continuing our segment on patients. Okay, we're continuing our segment on the UK supply chain and patients. You know, over the last several weeks, we were focusing on growing, and now we're actually looking at the end users. So over the next 10 weeks, we're going to have loads of end users and loads of people from that part of the industry. Before I move on with the show, let's play the advert, and then I'm going to introduce everything. I'm sure you've heard before that good quality CBD needs to be really, really expensive. This is the new view of CBD, a product created by users for users, a product at an affordable price, available everywhere, at any time, at the simple click of a button. Just CBD and MCT oil. No additives, no preservatives, and no flavor enhancers. It's a simple subscription-based service. The cleanest possible CBD delivered to your door for the lowest possible price. Your product, your rights for the lowest possible price.
I'm sorry, that's the coolest advert in the world. It's just so cool. Every week, I've heard it for 29 weeks. I love it. I never get tired of it.
Whenever I see it, I always smile, thinking that I'll smile because I'm wearing the same shirt as on the screen, but I never smile. So it's like looking in a mirror that doesn't actually do what you know what I mean? It's like looking at a reflection that doesn't do what you do.
That's how television works, you know, if you're watching it.
No, it's new to me. It's very new to me.
Word to the wise. Okay.
On with the show? Okay.
Yeah.
So over this segment, we're focusing on medical patients, their interactions with cannabis and the processes they go through to procure their medication. Whether legally or illegally, we don't judge, we just want to learn. As we have seen, many people choose to medicate themselves with cannabis over conventional pharmaceutical products, like with cases of epilepsy, kidney failure, pain, and other ailments which we've heard about over the last few weeks. And there are a lot more which we're going to hear about over the coming weeks. As we have heard, when patients are left to self-medicate, self-assess, and take their escape from ailment into their own hands, good things seem to happen. Over the last couple of years, the UK has legalized the right to medicinal cannabis through specialist GP prescriptions and fulfillment. The industry is still new and jumping through hoops set by the UK government. The interesting thing is, the powers that be, the UK powers that be, the government and its ruling bodies legalized cannabis without a framework or laws in place. As we have discussed in recent weeks, the laws around growing, cultivating, extracting CBD and THC-rich cannabis is extremely governed and restrictive in every capacity. As we're going to hear today, the laws governing the consultation, prescription, and fulfillment of cannabis medicines is also tricky, to say the least. There are issues with maintaining prescriptions, as we heard from Taneem Montgomery several weeks ago. Access is restricted and limited. Another voiced complaint is cannabis prescriptions are very expensive. The reasons for patient frustration make sense, but it's the laws governing this space that do not make it easy for cannabis care providers operating within the legal framework of UK specialist medication law to do anything else. Just take what we know so far. No THC-rich cannabis is currently being produced in the UK for anything other than research purposes, and very few, if any, farms in the UK produce CBD from hemp. There is no local legal source of any cannabis-related product in the UK. Nothing we consume in the UK is produced in the UK. There is no sea-to-shelf supply chain. Everything is imported, so it passes through many hands and many borders. Everyone slaps on their percentage, and it makes it impossible to keep costs low. As is with the case with all of the growers we've met over the last 12 weeks, we see people wanting to do more, but their hands are legally tied and bound, and their potential actions are restricted. There is this idea also that doctors are not taking to the new system, this new green way of thinking. There's also this idea that doctors are not taking to this new system and this new green way of thinking as quickly as patients need them to. Doctors are slowly signing up, but cannabis is still far from mainstream. This means patients are limited to a few doctors, and once again, the point of restrictive access is raised. In the UK, there are thousands of CBD brands and hundreds of CBD companies, but there are only a couple of THC-rich medical cannabis distributors. Our guest today is one of them. His name is Jonathan Nadler. He's from the Lifey Group. The aim for today is to get an inside view of the pros and cons of the UK medical cannabis system. Nothing is ever perfect, and if it seems to be, then you are ignoring something. Now, we're going to welcome on our guest, Jonathan, and we're going to have a critical conversation. It's going to be a lot of fun. Let's bring on Johnny.
Hey.
Fair introduction, right?
Very good, very strong. Nothing to add.
That's it. So let's just dive straight in with the show. Thank you so much for joining us today. I mean, it's incredible what you've built in the last couple of years. Like, I actually personally know several patients who have passed through your system, and seriously, you've really changed lives. I mean, considering, you know, you're the first person to set up a medical cannabis clinic in the UK, it can't have been easy. I can't expect that things have just gone right. I can't expect that, you know, there hasn't been hurdles and there hasn't been stresses and there hasn't been, you know, that tad of animosity, because that's just what happens in this industry. And, you know, I really want to get to the bottom of that today. And I want to talk about your journey and how, you know, like how the last couple of years has been. And then also from an inside perspective, what your views are going forward for this cannabis system, which you've so gratefully created for all of us. So thank you very much as well. And, one day I'm going to get a prescription and I'm going to be very happy as well. So I'm just going to throw that out there. So it's always my first question, and I love this question. What made you choose to enter this space? Why did you choose to join this world?
Yeah, good question. Yes, so thanks again both for having me on. I watched a few of these over the last few weeks. It's fantastic, and you're doing a great job.
Thank you.
Thank you. And yeah,
it's all Russ. Look at him. Stunning. Stunning.
All right.
Sorry, Johnny.
Yeah. So I mean, my background is nothing to do with medicine at all or pharmaceuticals. I'm an entrepreneur, really. I started my first business when I was 24 and grew it for a number of years, and then exited successfully.
What was it?
It was just a marketing agency, very straight, very simple. And then I went on to run a strategic consultancy, again, very kind of normal, again, with a successful exit. And then 2017 came, and I was kind of sitting there thinking, well, okay, no more agencies. It's time to do something that actually appeals to my soul and mixes all my pleasures. And, you know, that involves business and cannabis. And I was looking abroad and seeing how things were opening up in different markets, and it was obvious where we were heading. And you know, this is pre-rescheduling for medical cannabis 2018. So I did what I could to get into the industry, and that for me was CBD. So I actually think it's the first time I came across your business partner, Ollie, was 2017, and I decided to set up a organic CBD business. I was the first to have an organic range in the UK market. And I after kind of 8-9 months of dispensing in health food shops and pharmacies up and down the country, I ran out of money, and I went looking for some cash, and I found a fund which was focused on cannabis. And before I knew it, I exited the business to them and became partner of the fund as their first employee. And from that point onwards, I've just been growing medical businesses.
One thing I want to throw out there: if you do not get to a stage where you've lost basically all your money in the cannabis industry, then you're not properly in the cannabis industry. I mean, like it's like one of those rules. If it doesn't break you, then it will not make you. If you are not broken into 1,000 pieces on the floor and have to glue yourself back together again, you haven't officially been in the cannabis industry. So, it is relentless.
It's crazy.
I gather, Jonathan. Let me just ask some of the. Can you hear me all right?
Yeah, loud and clear.
Oh, great. Just some of the nuts and bolts of this. So there you are. You're thinking, what am I going to do with my life? And you think, well, I'm going to combine the things that I like. But then I'm confused. I'm not confused, but I'm fascinated rather. How do you then say, right, I am going to build a business? Where do you even start with that?
Yeah. Just generally, I mean, it's difficult. It's a challenge. I mean, on a very basic level, you need to know how to set up a corporation, and then you need to know how to execute on a plan. You need to know how to make a plan. You need to know how to execute on the plan.
The business side, I get, because we've kind of travelled a similar path. I'm just fascinated in an industry which you knew nothing about. You're thinking, right? Yeah, I'm going to do organic. I'm going to be the first organic. Where did you start to look for suppliers, and how did you decide your range? And all
how
of those
do you
things?
take the first leap? Basically, like what makes you go from I'm in that comfort zone of working normal jobs? Do you know what I mean? Because like you said, you want to do something which was a bit more a little bit less normal. So I mean, like how do you take that first leap?
Yeah. No, look, it's some of it's more kind of luck than judgment, and some of it's research. And I mean, I knew that I didn't want to complete the journey as a CBD brand. I knew that much. I knew that I wanted to do something in the space that ultimately focuses on the medical side. And I actually started my journey by researching a ton of these chat forums that you get on places like Facebook. And what I realized very quickly was there was tens of thousands of patients that were consuming CBD and knew nothing about what to expect from consuming. So the messages were always the same. It was I think it's helping my pain, but I'm not sure. Should I take more? Should I take less? Is this strength of CBD correct for me or not? I've got this ailment. Will it work for that? And it's this kind of the same stuff. And it just kind of took me down a path, and that path ended up being, okay, well, look, there's a few things that I just need to do very quickly here. The first one is bring out a range of oils with education, information, a way to give these patients or these consumers what they want. And then how else can I put other stuff in my armory to work? So I'm a product guy, I'm digital marketing, and I said to myself, okay, well, there's a management app required here. If there was an application where patients could on a daily basis diarize how much they're consuming and what impact is happening on the condition or ailments that they've got, then that patient will be able to see very clearly over a period of time that actually it's working for that condition. I was a 9 in pain, now I'm a 6. Or I couldn't sleep longer than 4 hours, I was an 8. I had insomnia, now I'm doing 8 hours straight. So I built that app at the same time as starting the oils company. It kind of went hand in glove for me. And then I think from that point onwards, it's kind of been a very kind of organic journey for me. I mean, so I exited that business. I actually did a very small thing in CBD before I got firmly into medical, which was help to launch the first CBD snap bar here in the UK. And then I was just completely focused on medical.
Where was that? Where was the snack bar, Jonathan?
The snap bar, it was just a small side project.
I'm just curious.
This is what happens.
No,
when
I
you
know,
get
but
into cannabis,
where was
you
it?
say yes to all these different businesses. So they launched Plant Organic here in the UK.
Very cool.
It's called Neuro. It's called Neuro Bar. Look, it's been a okay success for them, and they're growing extremely well, and they're very well listed, and they're doing
the market's still very new, though, isn't it? As in, like, that's one thing which we still say at Taylor Mammon. We're massive manufacturers. We manufacture for literally everyone, and one thing which we've realized is the market's not there yet. That's why we're doing this education, to help people understand more. You know, it's why I spend hours on a weekly basis finding guests like Jonathan and building out like episodes to help people understand the market more, because we're not there yet. I mean, as a UK population, that understanding of any type of cannabinoid is so lacking, and just people still also they see medicines as very generic in the UK. You know, you get sick, you get medicine, you get better. It's 1, 2, 3. Whereas in the world of cannabis, it's you get sick, you go on a journey to find what cannabis works for you, and then you get better. And it's a little bit more of it's not so much of a straight line. And I feel like, UK patients really want that straight line. If I'm walking in a straight line, I'm going to walk out in a straight line, and I will have my process finished whilst I'm on that conveyor belt. And it doesn't work like that in the UK.
No. It's trial and error. It's trial and error. And you know, it segues onto where I went next, because, you know, the law was about to change in 2018, and it was clear as day that the government were going to do their bit, which was reschedule, you know, stop the noise, reschedule, get it done, and then wash your hands of it, and say it's NHS's problem now. You know, they need to resolve it. And I could see clear as day, along with my business partners, that there was nothing. It was barren land. You know, that there was about to be a law change which allowed for patients to receive a prescription for medical cannabis, but no one knew what was going on.
There was no framework. Exactly. Nothing. No framework.
So we built an education platform for doctors. We said, okay, look, doctors' education is absolutely critical. They're the gatekeepers. If they don't write prescriptions for medical cannabis, no one is getting medical cannabis. So with Professor Barnes, who I know you know, Ollie, we went about Mike.
Big Mike. Holler to Big Mike.
So he came in as director of education. We had a number of prescribing doctors from different countries who were expert in writing scripts for medical cannabis come and assist with writing modules and modules and modules of online education. So it was basic stuff, like, you know, the phytos, breakdown of cannabinoids, even the kind of indicas, sativas, hybrids, what all these things mean, all the way through to contraindications, interactions with different medications, how to use medical cannabis for different conditions, what the evidence base is for each of those conditions. It just goes on and on and on and on, all the way through to a very detailed module, which is just about prescribing. So there's everything you need to know about how to prescribe medical cannabis. So we went and educated them, and you know, we've had 5,000 healthcare professionals use that platform. And off the back of it, we found some doctors. We found some doctors that had a really keen interest. They were legally able to prescribe, which means that they are specialist doctors. They're not GPs. GPs can't prescribe cannabis. So they're specialist doctors on the GMC register, and they were willing to put their head above the parapet and say, "I'm going to do it. I'm going to go against NICE guidance, which basically say, unless it's, you know, spasticity from things like MS or nausea and vomiting from chemotherapy, NICE say no."
But so NICE also say, the NICE guidelines also state that it's basically, if a doctor knows he can help someone, he should do everything in his power to help that person. So NICE guidelines are a little bit, I want to call it, what's the word? Contradictory. I think that's the best word, because it's that whole idea of you are only allowed to do this. But of course, if you see a man on fire, of course you could throw water on him, even though water is a banned substance. So I mean, it's very strange. When I spoke to your compliance officer, Jonathan, that's basically what she said to me. She was like, "Look, at the end of the day, the doctors are, by nice guidelines, the doctors are not allowed to leave you in pain. That's what the basis is. But there are rules which break it down. It's basically what I've assumed is however your brain is trained, however you read nice guidelines, your brain will understand it in a different manner. So me, who's a little bit more optimistic, I'll be like, yeah, I could do this and I could do that. And the more pessimistic doctors are like, no, you can't do this and you can't do that. And I just go on, Ross.
Are you saying that there's sort of a weak? It seems to me as that there's the outsider here about it every week, as I do. There's that the in that classic phrase, your words are open to much interpretation, which is pretty strange for guidelines, which should be pretty rigid. Interesting comment from Dawn Cragg, MBE. Hi, Dawn. So nice to see you. Very interesting topic. I have many clients who are helped by this.
Amazing.
I have
do you know Dawn?
Many clients who are helped
Johnny,
by this.
do you know Dawn?
I've never met Dawn, no.
That's amazing. Johnny, Dawn, do business. 10% goes to Ollie and Russ. Awesome. This is how we make our money. No, but seriously, like, no, in all fairness, speak to each other. This is what the show's all about.
I forgot what that word means. So you see, my thing that I have been going on, I've been going on for 29 weeks with Ollie, going on this educational course, is I'm astounded that if somebody is in pain, and if somebody is having serious, ghastly issues like that video, that heartbreaking video of that little baby, you know, having convulsive fits, and you know, we could go on about it, why people are being so short-sighted and saying this would help. And when it's been proven in those individual cases, just to be clear with my words, that it's helped them, that it's assisted them, that it's alleviated their suffering, I'm at a loss to understand why there's such a reluctance.
Well, and that there is one of the more pithy questions in the market. You know, in this industry, we talk about that week in, week out, and it comes back down to the way that marketing authorization is given to pharmaceutical drugs in this country, and the way that different medications are categorized. So, you know, cannabis is categorized as an unlicensed medicine. And
but
therefore
Novocaine, it's completely legit. Oxy,
well, there we go.
You know, you want synthetic heroin, or that new one, fentanyl. Have you? It's just insane. It's insane what they're doing. Fentanyl patches and stuff. I mean, this is just. I mean, I met this woman recently. She's been on fentanyl for the last 5 years, and she literally said she's a corpse. She's a walking zombie, and it's just like.
All right. Oh, sorry. Just for everybody who doesn't know. No, hang on. But for everybody who doesn't know what it is, including me. So what are you saying? So that synthetic heroin and stuff.
Yeah, they're like synthetic heroines and like synthetic cocaines.
So
synthetic...
they're being. So just to be clear, they're being prescribed, and that's okay. But what Jonathan's trying to do comes under much greater scrutiny. Yeah, is that what you're saying?
Yes, exactly. They're prescribed before you would receive a prescription for medical cannabis, and there lies the issue. You know, medical cannabis, when it's unlicensed medication, is there as for an unmet need. You know, and a classification for unmet needs is you have to have tried 2 medications for a particular condition, and those medications haven't worked. And at that point, if your clinician decides that you are eligible and they are happy to prescribe an unlicensed medication, then they may go on to medical cannabis. So it's not front line. It's at the back of the pack.
It's not even at the back of the pack. It's at the back of the second pack. Do you know what I mean? You got to go through 16 packs of cars before you find that joker, which can actually help you. It's insane. It's insane.
But it's the evidence. It comes down to the evidence.
So the doctor. I just want to sort of drill down on this because I find it extraordinary. So and very fascinating. So patient X comes along, and the doctor prescribes whatever it might be. And then you've got a situation no, that I don't feel any better, doc. And then he says, try the next thing, right? Am I getting this right?
Yeah.
And then he comes back and no, all right, now I can legally do that. Who's making the thing? If the guy comes along and says, I've got terrible stomach ache, and it would take this. Well, I've still got.
Mm.
How do you know? I mean, do you see what I'm saying? If somebody's got a
Yeah.
cut or a wound, you can see if it's healing up. But
Yeah.
if somebody's
Yeah.
got a stomach ache, they got a stomach ache. Or is that being too
Well,
simplistic?
Well, I mean, but no, look, it's an interesting point. I mean, you're dealing with patients who are usually extremely sick, you know, so they've tried, you know, if it's a mental or neurological disorder or some kind of pain disorder, you know, a chronic pain disease, for example, you would have kept going back over a period of time, and there's no real kind of understanding of what that period of time is. But you know, it's a period of time. It's a significant period of time where that patient has been going through the process to go from one medication to it being, you know, not fit for them for whatever reason. It could be the side effects. It just could be it's not working efficiently, and they move on to another. And after that, if the doctor decides it's now time for unlicensed med, then medical cannabis comes into the frame. So it's down to the clinician, you know, the specialist doctor who's got years and years of experience in their subject matter, for their condition. It's down to them to make a decision in front of the patient based on what they believe is right for that patient. So nice guidance are just that, they're just guidance.
The problem with the nice guidance, okay, I just want to throw this out there because it's a government law which is kind of, you know, it's the government law which is holding the strings and making you dance like a puppet, all right? And it's making us all dance like puppets, you know, and it's basically it's giving us a cage and strings, and we're in that sort of, basically we are Punch and Judy. That's the best way of saying it. So these government guidance and these laws don't take into account the quality of life which comes with cannabis, which is lost with other pharmaceutical medicines as well. So it only looks at pain being removed as opposed to life being given. Now, one thing I have seen over and over and over again with loved ones and with friends and with people who have come to me for help is that no one has a good time on morphine. Okay, maybe for a day, maybe for a week. But as soon as you're taking morphine every day for the rest of your life, no one has a good time. No one wakes up every day and thinks, oh, my life is great. But the average cannabis user, okay, who wakes up every morning and they, you know, that they medicate themselves with cannabis, you know, like from what I've seen, wakes up, their lives are better. Their quality of life is better. They laugh more. They feel more. They generally are more.
Yeah.
And I feel like, sorry.
Yeah.
Let's look at this comment here that's just come in from Veronica Curran. This is extraordinary. I have no idea why they can prescribe opioids, morphine, oxy. They had me on for 26 years, but that's okay. Pain Clinic can see I've tried more than 2, way more, but they still refused medical cannabis. To me, just as a human being, it seems completely counterintuitive.
Jonathan, why do you think that might be the case?
Self-refer, Veronica. I mean, look, this is the problem: is that the institutions take a long time to catch up. This is all about education. The whole thing's about education. You're seeing doctors come into the medical cannabis market more and more month on month. You know, the growth now compared to how many doctors were prescribing a year ago is significant. But there's still some that are behind, and they're behind for a number of different reasons. It could be because they look at nice and they focus on nice and they don't want to divert from nice. It could be that their rural societies are telling them not to go anywhere near it. Again, this is all legacy issue. This is the stigma that's that unfortunately is completely left behind after rescheduling. It's ingrained in the NHS. It's completely ingrained in their medical service. So I would say self-refer, go to a clinic. We have one, the medical cannabis clinics, and go through the application process, refer yourself. The clinic will then do the triage process to make sure that you are eligible, and they do that through a number of different channels, all for safeguarding you as a patient and also our doctors. And they will go and get your patient records with your consent from your GP or your other specialist doctors, and then you can go and have an appointment over a video like we're on now, and that doctor will make a decision then and there.
Jonathan, if Veronica wants to do that, and I feel so bad, Veronica. I mean, I don't know you, but thank you so much. I know you follow the show most weeks. 26 years you've been on this stuff. I dread to think that the effect that's had on you. If Veronica wants to hook up with you and see professionally and go through the process, how does she do that? What can you give us some website addresses or something, anything like that?
Yeah, just go to themedicalcannabisclinics.com, and it's extremely straightforward. It would take you no longer than 3-4 minutes to get through to book an appointment.
Okay, great.
Can I ask you a quick question?
Yeah.
Sorry, finish this, and I want to ask.
No, carry on. No, carry on.
www.
Yeah.
The medical cannabis clinics.
Plural.
The medical cannabis
clinics.
Clinics.com.
Clinics.
Yeah.
Plural. Okay,
Yeah.
there you
Plural,
go.
yeah,
Plural.
plural.
Okay.
Fine.
And
So
everybody else.
you mentioned something earlier about how when you guys first started, there was like so few doctors, and now there's a lot more. How many doctors were there when you first started up in like 2018? Was it 2018, 2019?
Yeah, there was 1 or 2 prescribers.
Amazing. And now?
And now, I mean, it's around 70 to 80.
That's amazing.
But
amazing.
But you know, we've gone from a handful of patients beginning of 2020 to, I think it's probably somewhere in the region of 5,000 patients now.
Amazing. I spoke to you 3 weeks ago, and your numbers were not this big.
Yeah,
it's gone mental, right?
That's the industry. So
I
there's about
know.
5,000 in the industry, of which we've got around 60%.
That's incredible.
Yeah.
And then in terms of doctors in the industry and your organization?
Yeah, so our clinics have just under 30 prescribers.
Incredible. Yeah. And around 3,000 patients, right?
Just over 3,000 patients now.
So that's 100 patients per doctor.
Yeah.
How does that work? If you don't mind me asking, as in like I don't know this. I'm not that good in terms of how, I know that let's say every teacher has 30 pupils in their class, but I don't know how many patients each doctor has. I don't know what the standard math is. Like, is that oversubscribed or is that undersubscribed?
Well, I mean, look, some doctors work a day a week, some doctors work 4 days a week. So it doesn't split down that way. I mean, some have quite a few, and others have just handfuls. Yes, there's absolutely more demand than there is supply. There's no getting away from it. I mean, the appetite for a natural medicine like cannabis is crazy.
Especially with all the information coming out around the world right now. And we look at our brothers and sisters in every other country around the world, and we hear these incredible stories. Like poor Veronica's probably watching the world get off of opioids by using cannabis. She doesn't want to break the law. She doesn't want to go out there and be seen as a criminal. She doesn't want to take her medical life into her own hands, because once you do that, there's no going back. Do you know what I mean? Like you can't then go to a doctor and say, look, by the way, I was with a doctor for 15 years. I then stopped dealing with doctors because I didn't trust them. But now I want to come back to you. Here are my records that I've handwritten. It doesn't work that way. No. So, I mean, that whole idea of people like Veronica who have put their faith in this system, and they don't actually, they don't get anywhere. It's insane.
It's insane.
It looks like it's got a more happier situation than I thought it was, because Veronica's written, I've stopped all oxy, etc., and on lovely oils. I couldn't wait on them. Kiss. So
amazing.
Yeah, I see. Right. I'd like to. Can I put you on the spot, Jonathan? Because I was.
Don't be mean to Jonathan. Be nice to our guests, Ross. Only I'm allowed to bully our guests.
Only you, with the charm of a bull in a china shop. Right, today, 2 things. Number one, I had to go to the doctors today. I finally got an actual face-to-face, not on a video, real life thing. And you get to a point in life, there's a certain load of things to do. And he said, oh, well, I can't. And it was like, well, I can only discuss 2 of them. Can you pick what you wanted to? He was a lovely guy. Please don't misunderstand. NHS, a terrific guy, saw me on time, all the rest of it. So I'm not being rude. And it's not down to him. But I understand they've got to get me in and out, and every other Herbert, in and out, 10 minutes, 15 max. And I've never had that before. Tell me, you can choose which ones of your ailments you want to discuss. And I'm thinking, okay, I better put them in an order of how much they're buggering up my life. So that was the first thing. I found that extraordinary, because one of the things at Men's Radio Station that we're passionate about, and we've been talking about for nearly a year, is that the side effects of COVID, mentally as well as physically, and let's not talk about the economics, that's another issue. We haven't even begun to see the actual side effects of this, combined with the fact that doctors are going to be swamped. There's 4.2 million operation backlog. Think about that. 4.2 million operations in the backlog. So one, Jonathan, how the hell is the NHS going to even begin to look at all of this? And the other thing is, somebody said to me, I was talking in glowing terms about Ollie and the show and the 29 weeks, and he's actually my best pal. And he said, it's all snake oil salesman. It's all. I said, it's not.
Oh my
it really
God.
works.
He's not my best friend anymore.
No,
We've
he's a
just
lovely,
fallen
lovely
out.
guy.
No, I'm sure he's lovely.
You will. But he said, well,
stick him in a room with me. I'll convert him.
Yeah, you'll beat
Give
him
me
up.
40.
He's tight.
Give me 45 hours in a
eight.
still room.
Yeah, no, 45 minutes feels like 45 hours. And it's very interesting. I said, no, you've got to be a bit more open-minded about it, you know?
Well, look,
what is your reply to that?
Yeah, so I'll just dance through those. I mean, look, time for primary care frontline appointments, I think it's average 9 minutes now. So, of course, you know, when you see lots of your patients, it's complex care issues. You know, it's never a single thing. They're probably taking 6 medications. How many things can you get through in 9 minutes? Not many. So I don't ever. I mean, I think it's an absolute long shot to think that GPs will be prescribing cannabis anytime soon. There's
nowhere in the world that does it. Nowhere in the world is cannabis on the like a government prescribed product. It's nowhere. It is all private everywhere in the world, because it has to be. It's too personal. It's too personal. You can't.
Well, I mean, it's a challenge. You know, you say to a doctor, "Okay, Mr. Doctor, it's time for you to prescribe cannabis. Fine. What do I need to do? How many capsules? How many tablets?" No, sorry. It's a percentage of different cannabinoids, and with different carrier oils or different flowers and different strains. Sorry, you know, the curtains are up. It's not going to happen. So I think that's the first thing to note, is that everyone talks about NHS. There is this 2-tier system in cannabis at the moment, which is not good for patients. Which means, you know, patients are either wealthy enough to pay the money for their medication on a monthly basis, or they're not. It's as clear as day. You know, so you've got some that are going to benefit from this, and some that are really not, and until NHS opens in some way for those people. But how is it going to open? It's going to open by a couple of different conditions being on the NHS only, and all other conditions are going to be private and probably insured by the insurance companies.
So what do you reckon will be on the NHS? So, once again, predictions. This is not fact. No one hold Jonathan to this.
Exactly. Yeah. Well said. I mean, you know, I'll answer that question, and I'll go into it by just answering something else, which is, you know, the way that you do research on a pharmaceutical with random controlled trials, it just can't happen with natural medicine like this. So, you know, we have to look at observational study. We have to look at registries, which means that we need to see a fundamental shift in the way that the medical sector classifies medication and approves it for use for certain conditions. In terms of what conditions will be used in the NHS, they are managing to do RCTs for epilepsy, so for refractory epilepsy in children. So epilepsy that is treatment resistant, they are going through a proper trial, NHS trial. Within this year it's starting, and it will end probably 18 months to 2 years from the start date. That might give them enough information for them to say, okay, For epilepsy, we're okay. It's on the NHS.
MS, you have the Sativex, don't you?
MS, you have a medical authorized product, so that's done. The other one that could possibly be end of life. I mean, end of life
Palliative care.
Palliative care.
Yeah,
Yes.
fine.
In a very kind of cynical sense, unfortunately, those people aren't with us for long, and therefore medication, from a cost perspective for the NHS, doesn't need to be exuberant.
And also, if you're gonna go out, you might as well be high whilst it's doing it.
Well, there we go.
Do you know what I mean?
Well,
how do you want your loved ones going? Do you want them to go happy or not happy, comfortable or not comfortable? I mean,
euphoric, or in an absolute stupor of drug-induced mess. Do you know what I mean? Like it's.
Unfortunately, guys, I have experience of both sides of that coin.
I'm sorry,
one with palliative care and one in a hospital, and I know for sure which one I would choose, and I was there for both of them passing, and I can definitely tell you which one I'd choose. No ifs or buts. No ifs or buts. It's the one thing in this area I can speak of with some absolute 100% certainty from personal experience that, trust me, I wish I hadn't had. But that's not the point. It's such an important point that's never been raised. That's such an interesting thing you've made, the pair of you, about palliative care, because, you know,
he's on the inside of the system. He knows this stuff, Ross. That's why we brought him on here.
I mean, the point is, if you look at it just from an overall umbrella of just being human, all right, just humanity, being decent. If somebody, it's absolutely, there's no way they will survive. Unfortunately, it is a matter of brief time. They should be made, without any doubt, as comfortable as possible. Now, I'm not going to go into any personal details, but it's within a hospital environment, as you guys will know, and our audience all over the world will know, they are duty bound to prolong life. Now, it's irrelevant whether that life has absolutely no quality whatsoever. And that is, it's a shocker. You know, it's easy talking about these things in kind of, nebulistic terms, but when you're seeing it, it's a very different thing. And I couldn't agree with you more. That would be a decent thing to do.
Exactly. So, but I think that is where it has to end, because, you know, if you go much further than those types of conditions, or ailments, or whatever it might be that you're trying to treat with medical cannabis, to others like pain and certain psychiatric conditions, you're opening it up to half the population. It would kill the NHS.
It would kill the country. It would destroy the country. And then what would happen is corners will have to be cut.
Why do you say that?
Why
would it kill the country?
Well, number one is we have no UK-based supply chain, which means everything would have to be bought in. So it's not even like, so imagine you have a farm in the UK which produces $100 million worth of crop on a yearly basis. 50 million of those dollars are going straight to the government. So if the government had to spend $50 million on cannabis, it's basically covering itself. If the UK government is basically spending all of its money and it has no ability to generate any income from this new green revolution, and everything is bought in, you've got hundreds of thousands and millions of pounds of tax money which are disappearing, and there's no chance for it to ever come back. Now, what happens when you attach a tap to a bucket and you leave the tap on? The bucket empties. But if you attach that tap to the bucket and you put a tube going back into the bucket, it recycles itself. Now, fact of the matter is if you were to, it's actually very smart, all right? Like, I know Johnny's laughing. He's like, oh, I didn't realize Ollie's this smart. Ollie's smart, okay? And what happens is...
I knew you were smart.
Theoretically, if the government was to kind of put itself in a position where it monetizes this, it could very easily maintain the system. But the groundwork which is set for, they legalized cannabis without a framework in place. And it was a 3-paragraph law which they changed, which had nothing to work on. Talking about specialist medications and talking about following nice guidelines, it meant nothing. And people like Jonathan have come, taken this system, turned it into something practical. Fact of the matter is if he had done one thing wrong, they would have come and shut him down with no, like no refunds or anything. He set up something incredible, but the system is not there behind. The system's not there in almost the foundation of our economy and the foundation of British culture to provide this system to the end users. My dream is that everyone gets it.
Would it be too much of a stretch to say this? That nobody foresaw, I'll have to do an analogy, nobody foresaw that the internet in all its forms would take over our lives. So therefore, I referred to the internet from the moment it started as the Wild West, because it just seems to be ungovernable. And so whatever laws they have, the laws haven't caught up. The technology has zoomed ahead. So I'm just wondering, would it be a fair assessment to say that the laws and all the guidelines are way, way behind the speed at which you, Jonathan, and you, Ollie, are zooming ahead?
Yeah. Look, regulators take a while to change direction because they're regulators, and their job is to be risk adverse and is to be conservative and is to pick into it and to take time to investigate and analyze before making decisions. So yes, they are always behind, and unfortunately, sometimes it is about industry kind of nudging up to them and saying, "This is what we're doing. This is why we're doing it, and this is how we're safeguarding against anything going wrong within it." So it's almost like proving self-regulation to ensure that the regulators can fall into line once they see how it actually works. That said, that I think the regulators have actually been extremely good in the way that they've opened the market. I think they were slow to get going, but I think in the last year they've been good. They spotted very early on that there was a big issue with the importation of product, and it was costing patients lots of time and lots of extra money on top of the cost of their prescription. And they changed policy. So back in March 2020, we got to this point where it didn't have to be on an unnamed patient basis. So you had to actually write the name of the patient, send that to get your export and import licenses resolved, then bring the medication for that particular patient into the country. And they expanded it so you could bring a lot more volume into the country in one go, which means that clearly, you can better serve patients with their medicine a bit more promptly.
Right.
Now,
but they're still forcing you to go abroad to buy it.
They are. They are for now, and it's definitely a sore point for lots of people. There's no domestic grow, or there is domestic grow, but it's all going abroad. Actually, in the last
GW Pharmaceuticals is the only domestic grower who currently produces, and so GW, do you remember the company we spoke about who sold for 6.8 billion? Do you remember that? We spoke about a few weeks ago.
Yeah, I know. In fact, I talked about it at lunch today, and everyone's faces went, "What?" The outside world is.
They're the only UK-based producer. They are the only UK-based producer of high THC cannabis, right?
But it's changing. So so the crown dependencies, so Channel Islands, Jersey, Guernsey, Isle of Man, those guys are forward-thinking, and now they're saying, okay, licenses are going to be dealt out. One was given out not too long ago, and so there's going to be another cultivation, and that's definitely going to service the UK market and the rest of Europe. So it's going to happen. There will be domestic products in country, I reckon, in the next few years. But to be honest, the improvements in the supply chain have been so drastic that we're now in a position where there's huge volumes of a number of different flowers and oils always in the market. There has been for the last 2-3 months. Some of these, some of the balances or high THCs do go quickly, but generally speaking, it's improving massively.
Quick question: when it comes to storing all that stuff, so when we spoke to George Thomas from what's it called, Sativa Wellness Group, and oh God, I always call it George Botanicals because that's what it was called originally.
Yeah,
My brain just went, yeah. So basically, so George Thomas, he was telling us about, you know, the storage parameters and the Home Office governing and the checks and the basically the, you know, the laws around how you operate your business, okay, are so strict. So you were just talking about bringing in larger amounts. I assume when you were dealing with smaller amounts, you didn't really have to worry about storage issues. Nowadays, where do you store your stuff? What's the address, alarm number? And if you can give me like a postcode so I could just get there quicker, I would really appreciate it.
Yeah, sure, no problem at all. So I won't tell you where exactly, but I mean, just give you an idea. I mean, we're getting through well in excess of 50 kilos of flour a month at the moment.
Amazing.
So you know, it's really spiking. So yeah, just in terms, you know, yes, there's
and the average patient gets how much? If I'm me asking, the average prescription is
around 30 grams.
Amazing.
So we
1,500 patients.
Everywhere you look, the Home Office. Sorry.
Right. So you say 50 kilos a month?
Around 50 kilos.
Yeah. So it's around 1,700 patients, right?
Well, it's not far off that.
Yeah. So I was just doing some head math. My little inner.
That was very good. That was very good.
Come on. I love this industry.
So,
it's like a. Sorry, carry on.
So I mean, look, the Home Office, the MHRA, the CQC, the GPHC, they're all our regulators, you know, and so we have a partnership with a group who have the wholesale distribution licenses and the specials manufacturing licenses that you need to bring controlled drugs into the country and store. And they have all the right scheduled licenses to be able to do everything we need them to do. So they store, and then our pharmacy. So we acquired a pharmacy in 2019. And,
very cool.
It's basically a distance selling pharmacy. So you know we dispense cannabis to the doors of patients. We've actually just built a digital version of it. So now you can manage your prescriptions online without dispensary. Dispensary Green, it's called, for those that want to check it out. They literally call to our warehouse with daily orders of prescriptions that they have, and the medication is transferred from warehouse to pharmacy, and then the pharmacy does the last mile. Simple.
Amazing. That's absolutely amazing. It's very cool. Now, in terms of getting the stock in, okay, so in terms, you said you have a wider variety of flowers and a wider variety of products. It kind of ties in with I want to say my last question, because we've got 8 minutes left. So the scope of practitioners, this is what we were talking about before. The scope of practitioners is changing. I assume when you first started off, it was, like I said, there was 1 or 2 of you. It's very limited. Last week, I actually spoke to someone, our buddy Leon put me in contact with, a psychiatric doctor who is actually going to be on the show in a few weeks' time. She's incredible. And she was telling how she's also come into this space, which I thought was quite fresh, because, you know, that whole, you know, the psychology applications of cannabis is still very limited all over the world. It's not really a go-to, and I think it's amazing. So have you seen the scope of practitioners change? So as opposed to just being pain management practitioners, you now have oncologists or you know, this or that. I don't really know the words, but you know what I mean. So large proportion is pain, so it's pain consultants, but then from there it's psychiatrists and neurologists, a couple of gastroenterologists, oncologists, but yeah, you know, it's really pain, psych, and neuro. So I mean, when it comes to psych, I mean, it's kind of obvious when you dig into it. You know, if you're anxious, and you've had a number of different medications for anxiety, you might want to move away from anti-anxiety because of the side effects. You know, so for example, insomnia. I mean, you take a drug and then suddenly you need another drug for the other thing that it does wrong. So cannabis could offer a different solution for patients with certain psychiatric conditions. It's as simple as that. It's not preventative. It doesn't necessarily get to the actual cause, but it helps to manage. And
I mean, I think, you know, I know we're kind of close to time, so, you know, I think it's really important to just say on this point that there is a seismic shift in the Western world of medicine. Seismic. Cannabis is literally the gateway opener to a whole new array of novel applications for different conditions, and it goes to a change in perspective where it's around the preventative measures rather than just treating something to try and cure it. And I think that what we're going to
This is from a pharmaceutical level down, by the way, because I've got a buddy of mine and she works for Pfizer, or maybe she works for Merck now, one of them. But basically, she was telling me the same thing. It's all about prevention now. That's where they're focusing. All of their money is all on preventing. It's all on prevention because, well, they've basically like run out of ideas on how to cure people, which is great when you think about it.
Well, and people
say that again.
Well, people have got wiser.
Run out of ideas.
Well, look. I mean, just look what's happened. They brought opioid drugs into this world, and it ends up killing people, and became addictive. And you know, NICE have recently changed their guidance on pain, where you start with talking therapy. You know, you don't talk with an opioid. You don't start with an opioid. Sorry, you start with talking therapy, CBT, cognitive behavioral therapy, and then from there you move on to other things. So you know, there is a shift away from pharmaceutical drugs. There simply is, and it ends up looking at more kind of integrative medicines. So it's the way that it's like multidisciplinary teams of doctors and experts. So it's pain therapists working with psychiatrists, working with physiotherapists, with meditation teachers. You know, it's kind of
all different from what we grew up with.
It's completely different. It's
like the whole pills and jabs are kind of going out the window, and this whole, you know, take your life into your own hands, then, you know, you can make yourself better.
To be clear, if you got a broken leg, you got a broken leg, and it needs to be fixed correctly.
Yeah.
1,000,000%. I'm not saying if you've got a broken leg, a couple of drops of CBD are not going to help you.
I just think it behooves me. It behooves me to say that, you know, there are limits. There are limits to this, you know. If it's
well, look, I mean, but if you've got a broken leg, it could be that rehabilitation is handled in a different way. So, you know, I think the people that are changing the face of medicine are people that are, I mean, just step away from all of the brilliance that's happening around the kind of COVID issues and just the transformative stuff that's going on over in that side of pharmaceutical. But, you know, on this side, on this kind of little niche of cannabis and natural medicines and integrative thinking around how to better care for the population, there is a shift which will make it mainstream for a very, very long time to come.
Amen. Your mouth to God's ears.
Exactly.
I love it.
I'm laughing because that was my mum's favourite saying.
Your mouth to God's ears.
Yes, I said that. Veronica Curran, just as we come up to the end, a more deficiency in our body that need repairs. Thanks as always, an informative and a fantastic show.
We love you, Veronica. We really do.
Veronica Curran is not wrong. Every week, you know, Jonathan, every week, Ollie finds all you amazing people. It's absolutely nothing to do with me. He just tells me who's coming. I go, okay. And every week, the guests are stunning, really. You know, I think I like to use myself as a bit of a litmus test. And if I'm learning, hopefully, you know, everybody else is learning around that. One more time. Tell us how we can get hold of you, Jonathan. That would be delightful.
Yeah,
just give us a web address.
So our group is Life Group, LYPHE group.com, and our clinic is the medicalcannabisclinics.com.
His name is Jonathan Nadler. And if both of you, if any of you missed that, you can contact me and I'll give you his details. I just like the fact that someone would. Sorry.
Very quickly, Ollie Mammon. People often ask me, how do I get hold of Ollie? So I'm not going to hand out your phone.
Facebook
so
me, LinkedIn me. I'll give you my phone number. Should I say my phone number?
No, you really, really won't do that. But we're right out of time. Thank you so much, Jonathan Nadler. You've been absolutely fantastic. Ollie,
you've been incredible.
As always, a pleasure. Until next Thursday at 6 o'clock. Bye, everybody, and stay safe.